Good morning everyone. I am Dr. Sirisha. I am consultant ophthalmologist at KIMS Hospitals, Gachibowli. Today I will be talking about myopia as part of Myopia Awareness Week. What is myopia? Myopia is a disease of the eye, or rather a refractive error of the eye, where the distance vision is not seen clearly, whereas the near vision is seen clearly. Myopia most commonly affects children, or it gets detected in childhood, and it can increase as the child increases in age. It often begins in childhood and may worsen as the children grow older. What are the risk factors for myopia? One of the most common risk factors which we are all aware of is one or both the parents having myopia. The chances of the children also developing myopia are higher. The second risk factor is increasing nowadays, which is screen time. Because of this excessive screen time, the vision of the children is getting affected, which is causing myopia or other refractive errors. Thirdly, indoor activities or decreased outdoor activities is also causing an increase in the incidence of myopia in children. So these are the three major risk factors for myopia. What are the signs that the child might be having myopia or might be developing myopia? The first thing is they might not be able to see the board clearly in class. The child might tell you themselves that they're not able to see clearly, or sometimes the teachers can complain that the child is not seeing properly or not focusing well in school or class. That is one of the first signs of myopia. Another sign that you can watch at home is if the child is trying to go closer to the TV, or he is not able to identify objects properly or not able to read objects which are far away properly, then you can suspect myopia. If the child is complaining of frequent headaches or blurring of vision, or they tend to rub their eyes, that is also another indicator of myopia. Lastly, if they develop frequent infections in the eye, this can also be an indicator that they could be developing myopia or a refractive error, and it is time for you to get your child checked by an ophthalmologist to make sure that they are not developing myopia, or if they are developing myopia, then they will be given glasses. What is the treatment for myopia? Generally, most often the treatment for myopia is wearing spectacles or glasses. In myopia, we use something called concave glasses or minus powered glasses to make sure that the children are able to see clearly for distance. So why is myopia important? If it is detected early, we can prevent the progression of myopia. If the child is not detected on time, sometimes the children can develop lazy eye, or what we call amblyopia. What is amblyopia? Generally, when we have a spectacle number or myopia, we are not able to see things clearly for distance. Over a period of time, this number can keep increasing as our age increases, as the child's age increases, till a certain point of time where the brain gives up on the eye. The brain feels, oh, I can't see anything, so they start giving up on the eye. This is what is called a lazy eye or amblyopia. At this point of time, if it is myopia is detected and the child is less than 10 years of age, the chances of reversal are good. But if the child is older than 10 years, the chances of reversal are poor. Even after using glasses, this lazy eye or amblyopia can persist throughout life. How do we as parents protect our children's eyes? One, reduce the screen time. Screen time in children should not be beyond 20 minutes at a time and not beyond 2 hours in a day. Make sure that the screen is either bigger in size like a TV. A TV is better than a phone. Make sure that they don't have unlimited access to the screen, and make sure that they're taking breaks every 20 minutes or so. Encourage outdoor activities or playing outside in the sun at least half an hour to 1 hour in a day. This is preventive against the myopia increasing. And when they are studying, make sure that they're reading with good posture. Make sure they're sitting at a table and desk and reading. Make sure that books or whatever they're reading has to be held at a distance of at least 40 centimeters away from the eye. Make sure that there's good lighting when they are reading. Lastly, if you have any doubt whether the child might be developing myopia, or whether the child is having excessive screen time, or if you feel like any of the symptoms which I have described earlier are happening in your child, it is better to get them checked for myopia rather than miss it at an early stage. Thank you.